I'm Wendy Sontag, and I'm the Patient Services Manager for the Iowa chapter of Leukemia and Lymphoma Society. I talk to patients almost every day, patients or family members or healthcare professionals who've been affected by blood cancers, leukemia, lymphoma, myeloma, and often those patients need treatment with bone marrow or stem cell transplants. And once in a while, we also, I'll get a really distressed call from a family member of a patient who is not having much success with finding an appropriate match for a donor so that they could be able to proceed with stem cell transplants. And so as I've learned about this issue with cord blood, umbilical cord blood donation, it could be a powerful advance in options for patients, because umbilical cord blood is so much easier to transplant. We're also finding that it's some of the requirements that are needed to make a match between adult stem cells donors and the recipient patient. Those match issues aren't an issue in umbilical cord blood. It's much easier to Fortunately, a lot of expectant mothers, I didn't know when I had my children, I didn't know anything about cord blood donation, and I think most people are pretty unaware, and yet it would be such an opportunity for people to help, if they knew about the options that they could donate their baby's cord blood to a public bank that could potentially save the life of another person. It would be really beneficial to our public health and especially to patients with blood cancers, I think, if they could get some of that education from someone they trust, from their doctor or nurse or their prenatal care provider, to learn, how that process works and what their options are.